I welcome you all on this Moksh Academy PG Career Series session. Let me quickly give you some introductions, before we start our interactive session with Dr. Jinendra. All right. First of all, I thank each one of you to, be part of this session today. Today, of course, Moksh Academy, in this COVID world, have to, conduct these online sessions. But traditionally, we have been, training students for the USMLE and the licensing examinations, and for the, informative, awareness. We used to actually do in-person sessions across India. So, thanks to COVID, now we are completely online. But yes, happy to help you in this entire journey. All right. So I'm your host today, Chirag, and I'm going to run through this entire conversation today with our guest. Today. Today's session is something kind of an insider info, or a kind of a glimpse to what exactly is a journey of somebody just like you in a medical school in India. How did he actually overcome possible obstacles, and how and where he is during his entire journey. Today's session will be is of an IMG's journey from India to the US. So just keep that in mind. All right. Thank you very much. Now let's introduce you to the guest for today. So we are proud and happy to have somebody from your fraternity, Dr. Jinendra Lalit Satya. He is very much from Bombay. He completed his MBBS from the prestigious Grand Medical College JJ Group of Hospitals. So just like you, he had his dream to pursue a US residency. He further went on to do his MD in internal medicine from University of Miami. Subsequently moved to NYC, where he is a chief medical resident for New York Medical College. And currently, he is pursuing his advanced hepatology fellowship at the prestigious Beth Israel Deaconess Medical Center, a teaching hospital of the Harvard Medical School in Boston. His interest includes medical education, hepatology, and gastroenterology. So I welcome Dr. Satya on behalf of the entire student community. So thank you very much, Doctor, to be part of this session. Any opening remarks, before we start this power pack questions for you?
Thanks so much, Chirag. It's a pleasure to be here and talk to young students and hopefully provide them insight and answer questions which can be useful to them in their decisions along this long but rewarding journey.
Thank you. All right. So, students, I would just like to, let you know how the session would be phased out. During the entire, sessions, we will be asking lots of questions to Dr. Satya. Initially, we will begin with the USMLE examinations, some questions on the USMLE examinations, followed by questions on CV, residency applications, fellowship applications, American healthcare system, the current COVID-19 pandemic, and IMGs, how they have been the backbone of this fight. And of course, we will take up questions from students and parents. All right, so we shall definitely do that at the end of the session. Perfect. So now with this, let's begin our Q&A session today with Dr. Jinendra. All right, so initial phase of discussion will be around the USMLE examinations. So the first question, for you, doctor, is how different is the USMLE than a typical Indian medical college examination? What was your experience, sir?
Yes, there are a lot of major differences between the two systems, as everyone knows. To begin with, in India, we have one medical exam, which kind of decides if and where you can get into a PG subspecialty, whereas the USMLE is divided into 4 examinations. So, which I feel personally is a better way of doing it, because I think it's too much pressure just to have someone decide what they're going to do for their life just based on one day's score, they may be having a bad day, and I don't think that's fair just for that one day to decide what they're going to do in their life moving forward. So that's why I think the USMLE examination style is better because it's divided into 4 different examinations. And as I'm sure people who are on this call right now have a little bit of idea, but I'll just talk about it briefly. So the USMLE Step 1, Step 2, CK, which is clinical knowledge, and CS, which is clinical skills, and Step 3. So the USMLE Step 1 is really the first examination you would give when you're thinking about starting your USMLE journey. It focuses on the first and second year MBBS subjects, namely anatomy, physiology, biochemistry, forensic medicine, toxicology, second year subjects, pathology, microbiology, pharmacology. Um, so that's step 1, the basic science exam. And the focus really here is to test your foundation of your knowledge. So you will not find any clinical patient related questions here, but more so down to the molecular mechanisms and how cells work, etc. Is what the USMLE Step 1 tests. And I think it's a tough exam. The USMLE Step 1 for me personally, out of all of them, I would say it was the toughest one to prepare for, because all of us, are different parts in your training. Maybe you're in your second year, third year, maybe you're doing your internship in India, and that's very difficult in itself. Um, so USMLE Step 1, really creates the groundwork for you moving forward. And then comes Step 2, clinical knowledge, which focuses more on the clinical subjects which we encounter in final year of medical school, namely medicine, surgery, obstetrics, gynecology, orthopedics, and pediatrics. So this exam tests how you would deal with patients when they come into your office or in the casualty or when they're admitted in the hospital, which is what really is what you see on a daily basis when you're working in a residency anywhere. So personally, I liked the CK exam better. It was easier for me to prepare for CK because I like clinical medicine. I like patient care, so that was easier for me to prepare for. And then the other part of step 2 is clinical skills, which actually requires you, as everyone knows, to come to the United States. And it's a practical examination, although now, and we can talk about this later with COVID, there are certain changes, whereas this is being done virtually, maybe talks about whether or not this should be done moving forward. But when I did it 7 years ago and almost up until last year, this exam is available at 5 centers only in the United States, which means you really need to think ahead and book a test exam almost 6 to 9 months in advance. So ideally, you would do that when you're coming to the United States, for an elective or doing some research or a student rotation. You try to book this exam so that you can do it in the one trip and then go back to India and then finish your medical school or your internship or whatever else you may be doing. And maybe we can focus on this later, but the CS requires a different kind of preparation. It takes for granted that you have the medical knowledge, so it's more about practicing. How you would talk to American patients and how you would do physical examinations and a lot of other things and nuances that I can get into as well is what the CS focuses on. And then coming to USMLE Step 3, it kind of combines everything. So it's important to know, I'm sure everyone already here knows that the Step 3 is not necessary for you to apply for residency and match into residency. You only need to do the Step 3 before match if you want a H1 visa. If for whatever reason you're already on a J1 visa or you don't want a H1 visa, you're not required to give Step 3 before match day. You can give it when you start residency. For me, example, I gave my Step 3 towards the end of my intern year because I felt I needed that exposure working in a hospital here in the United States before I gave Step 3. It's also important to know that now the Step 3 is pass and fail compared to giving you a score, which was 5 years ago. So now they'll only tell you if you passed or fail. So out of all these examinations, typically, and everyone's thought process is that step 3 does not carry so much weight as much as step 1 and step 2. So that's like the overall gist for how the USMLE compares to the Indian entrance exams.
That was very detailed, answer. Thank you very much for that. You have covered actually a bit of it, but again, I would like to ask, since you've already appeared all the exam, which step, according to you, is most difficult and why?
Right. So as I said, people have different learning styles, and some people are good test takers and some are not. I personally think I'm not the best test taker. I do better at bedside and with patients rather than in front of a screen, but it's something you have to do. Everyone has to do. So for me, I was an intern. So just going back a little bit, the first time, and I think it's important for everyone to know, because everyone has different ideas about why they want to do USMLE and maybe different time points in their career where they realize, okay, let's pursue this route. So for me, I was in third year of medical school, which is, really the first time. As everyone knows in India, the first semester of third year is where you have some time, subjects that are not that important, unfortunately, and people have some more time, to catch up on other things. So that's really the first time where I thought of doing USMLE, and which is when I started preparing for my steps. And I came to the United States to do some clinical rotations. And for me, I realized step 1 was very detailed, very vast in terms of, the amount of material that we had for reading and a lot of resources available. So, with all of these exams, one thing I would say is you have to focus on a few resources because there's so much available. You don't want to go out and read 10 books and not know any of them well. I would rather you stick to good sources and just stick to them and do them again and again. I think that's what really helps. Repetition really helps rather than stretching yourself thin and trying to read more and more books. So for me, step 1 was the most difficult, and it actually took the longest time. If I can remember correctly, it took me almost 9 months because I was in my internship in India and I was on my heavier rotations. Sometimes I would not get the chance to, read for weeks because of 24-hour calls, etc. That everyone here will go through and has gone through. So for me, step 1 was difficult. Giving my practice examinations, DNB, and all of those available tests online, trying to see what is the best time to give it. And as everyone knows, there's a lot of pressure on this exam because you can only give it once in 7 years, unless you fail, and you don't want to fail. So let's say you pass the examination with just 1 point above the fail score, that score sticks with you for 7 years. You cannot retake the exam. So it's really important, for you to ask yourself when you're at the peak of your preparation, of course, based on what your schedule is, what your mental capacity is, and how you're doing on your practice tests. Because if you fail, you can give the exam again, but obviously then that's a red flag, which we'll come to later, is if you have an attempt on one of the steps. So you don't want to fail, you don't want a low score, you want a good competitive score. So there's a lot of pressure on this exam. And given all of this, for me, this was the most difficult.
Perfect. So next, of course, you've partly answered, but if you could, in detail talk about the various steps. When did you appear these all the steps? During or after the medical school, all the
Right.
4 steps.
Right. So as I said, I first thought about USMLE in third year of MBBS, and then I came here for some rotations. I actually took my step to CS, which was my first USMLE, because I came to Chicago for a rotation, and Chicago is one of the 5 centers in the country, and we had a big group that were preparing together. So it just made sense to give the exam rather than go back and make one more trip for the CS. Of course, all of us were nervous. It was our first exam, but I'm sure all of the people on this call, we all know that our Indian medical education is very good. It prepares you very well in terms of knowledge, which is, so everyone who's, let's say, in third or fourth year of medical school or internship or even PG clearly have the knowledge they need for the CS. They've seen all these cases that come up on CS. What they really need is to understand the format the process and what they really want from us. And ideally, you don't need more than 2 weeks to prepare for this exam, and you want to have a partner, someone you can practice with. All of us would practice on each other, FaceTime, video calling, all of those things, because practicing with someone is very important for CS, because you actually interact with patients who actually are actors. And as everyone knows, people who are patients in CS exam, they are paid to be actors for the USMLE, so they really know what to ask for and what to look out for. And every time you finish a patient encounter, they have a checklist where they mark whether or not this candidate did everything that was required. And some of the things that everyone has to learn, and I learned, was small things really matter, especially in the United States, is how you greet the patient. You make sure you say their name correctly, you make sure you introduce yourself, you make sure you shake hands with them, you make sure you're not facing your back when you're washing hands. These may seem really small points, but believe it or not, these are on their checklists. And if you did everything well in terms of your knowledge, assessment, treatment, but you didn't do any of these correctly, you may not pass this exam, unfortunately. And the other part of this exam is the note writing, which all of us can get used to on their software. And the third part, which they grade us on, is our English. So everyone comes from different parts of the world and India. So we have to make sure that we speak in a way that they can understand, because our accent is new for them, and you have to understand that. And I have the habit of sometimes speaking too quickly, so I tell myself consciously that I have to speak very slowly when I'm talking to patients, because it gives them more chance to understand. And given the difference in the accents, it's really important that they understand what you're trying to say. So I gave my CS during third year of medical school, and I came back, did my internship, and I gave my step 1 late during my internship. And as I said, that was not what I intended. My practice scores were not where I wanted them to be. So unfortunately, I had to keep delaying my step 1. And I ended up taking actually a research year after I finished my MBBS graduation internship in India. I did not directly apply for the match. I took a year of research to give myself some more time to beef up my CV and make my application stronger. And during this time, I gave my step 2 CK. And as I said, step 3 I did when I was already in residency towards the end of my intern year.
Perfect. So as you already mentioned, it's a customized or a different timeline for everyone, but with your experience, at least students can get insight of the journey. Perfect. How did you manage your parallel commitments of a medical school, internship, a research year, and the USMLE examinations?
Right. So it's difficult, because internship is hard in India, and sometimes we are working 36 hours at a stretch. So it's very important to make sure you understand when the deadlines are, because everything here is based on a schedule, and that's how things are. If you miss a deadline, let's say you had to apply for an exam or you had to send some paperwork to ecfmg, you have to really make sure that you're well aware of all the deadlines. And it can get a lot to handle at the same time, because you're doing your internship, you're seeing patients, that's difficult in itself. You're preparing for steps, there's a lot of pressure on doing well in the steps. And that you want to do your best in the USMLE, so you want to be able to get enough time for reading. And of course, trying to sort things out with paperwork, with visa, with the Indian embassy, your medical school, ecfmg. So it's a lot of work, but of course it's doable. You need to make sure you're on top of your deadlines, and making sure all your paperwork is well in time. It's important to understand that you will need documents from your medical school, so make sure that you know who to reach. So generally they're very good about it, because they've been doing it for every year. So every academic office in every medical school in India, will have someone who's done this before in terms of USMLE paperwork, so they know what you want. You just have to follow up with them, make sure you have their contact information, and that you follow up with them to make sure they send the paperwork that you need. Let's say for ecfmg certification, which is kind of the first steps when applying for residency, which happens when you finish your USMLE exam. So that paperwork from the medical school in India has to reach ecfmg in Philadelphia. So it's a lot of coordination, but it's doable.
So time management, people management, especially in the college, that I think is very, very important.
Yes.
That's a good insight. All right, you mentioned about you took a break here, and in India, people are very worried about the age factor. Now that you are in the American healthcare system, does age really matter in USMLE? Can older graduates also try for USMLE? What are your thoughts on that?
Yes, most definitely. If there's any country in the world that likes older graduates and likes experience, it's the United States. And that's something that should really not deter anyone from applying for USMLE. A lot of people I know, a lot of programs, hospitals prefer people who are a little more mature, have more experience. For example, a lot of them have already done post graduations in their home country, if it's India or if it's some other country. So, the plain answer to this is no, and older graduates can definitely try for USMLE if that's what they want.
And one part of it is also about, since you mentioned about a break here, is it okay to apply when you are ready rather than hurrying, right? What do you say on that?
Yes, absolutely. So, if you have everything that you needed, if your scores are good, and if your ecfmg certification is done, and if you really have an idea of how to go about things, and it's completely okay to apply right out of MBBS. Yeah.